on a we have clinic once a week. We meet in a clinic area that is a multidisciplinary clinic area, actually built specifically for us. We all sit together in a conference room. So I sit next to the neuromuscular specialist, the cardiologist, the pulmonologist is on the other side. We also have the genetic counselor, the GI specialist, the OT, PT are sitting with us. We are all in the same room and talking to each other. So it's a very active, fluid discussion between each of us. And in some regards, we really do participate in each other's management plans.
Yeah, that's the nicest. I have been in academic medical centers where it was really multidisciplinary, and I always enjoyed it so much more.
Oh my God, I think it's tragic when you don't have that. One, the patients have to come back for different appointments on different days, and nobody's talking to each other. And this is a disease that some diseases require it and some don't, right? But this one, boy, if you ever need a you need this instinct. So
I work on pituitary stuff, and it's perhaps not as acute of a need, but also requires a lot of different voices, and it's best for the patient, obviously, when they just see everyone and they all talk together
on the same day, right? And then you can get
on the same day.
I know. It's not like you have to say, well, I'm going to talk to Pete, Joe, Mary, and we'll get back to you sometime next week maybe about that tumor that's in your head, right?
If you haven't heard from someone in 2 weeks, then give a call back.
Give us a call. Till then, have fun.
Yeah, go enjoy a nice dinner.
Don't worry. Don't worry about that.
Yeah, no, it has been a frustration of mine in places where it's, for various reasons, it's hard to get people together since it's such a clear patient benefit. So nice that you get to work in that setting.
Yeah, it is very difficult, and it's been hard. It took a lot of work to put it together too. I had to tell you that.
I am sure, especially if you with insurance and billing and everything with all one day. We talked a little about how this is really such a great area of unmet need, and the fact that there are new therapies that may be coming onto the market or that have come onto the market. With those new therapies, when in general do you consider their use? I'm asking questions about, does it have to be on the market for a certain number of months, after guidelines, if they existed, mention them, after colleagues have used them? When do you tend to adopt new therapies?
Well, that's really an interesting question because in this disease there are no therapies, and so a new therapy is a clinical trial. So most new therapies come to light as clinical trials. So what you see is, let's just take viral gene therapy. So it comes to clinical trial, everybody lines up wanting to be on the trial, and then it sort of rolls out, right? So you're not on the therapy unless you're on the trial, but other than these new drugs coming on with trials, there are no new therapies. So sad.
All right. So I was going to ask more questions about new products, but we'll table that since there have not been
there are many.
Others coming to approval yet. Yeah.
Well, I guess you have Sarepta, right? Or you have the exon skipping drug.
Right. So things like that, and there will be, and one we'll look at in a minute. But would you think that a new product would have to be disease modifying, or would improvement in symptoms, or I guess for symptoms here, outcomes, biomarkers, ejection fraction be sufficient?
Well, I think these families are desperate for anything. So if you could promise them that they could move their little finger more, they are all in. So it's a very vulnerable patient population from a clinical trial standpoint because they would drink moose urine.
It's really tough.
If it meant that they could, breathe one day longer.
Yeah. That I understand. It's really tricky trying to help families, I think, sort through what they should try versus what is just something they could try.
Yes.
Let's now turn to the description of a potential product. You should have that link if you click on it.
Okay.
I'm going to give you a second to read through what's in front of you, and then I'll ask some questions about that too, but feel free also just to react to it either when you're done or as you look at it.
Okay. All right. Not impressed. That's my initial take on this.
Say